If you're not scared of the United States healthcare system, you should be. Let me tell you why. Medical bankruptcy in the United States is the #1 cause of bankruptcy. And if you think, well, it's okay, I've got health insurance, at least 3/4 of the people who do go bankrupt actually do have health insurance. Richard Lamb puts it this way: our aging bodies can bankrupt our children and grandchildren. We have run into the law of diminishing returns in healthcare, where we're often doing more and more with higher and higher technology and more cost for less and less benefit. It's hardly surprising, though. America has the most expensive healthcare in the world. You would assume that that's because we have the best healthcare, but let's see how we stack up. According to the Business Insider, the World Health Report in 2000 showed that 36 countries had better medical support than the United States did. And in terms of longevity, we rank only 27th out of 34 countries. Firstly, our healthcare system has some of the highest admin costs in the world. And our doctors and specialists are paid more to do the same procedures than in other countries as well. And that's quite considerably more in some specialities. Here's why he might say that. In the USA, between ages 5 and 39, we have 138% more asthma deaths than the UK and 977% more than Germany. And for diabetic leg ulcers per 10,000 patients, while the UK only has 5 amputations, the USA has 33%. Why is the United States healthcare so expensive? And the answers might surprise you. But in a nutshell, we can sum it up by saying that there is waste, overcare, and overpayment. And let's not underestimate the costs of doctors having to work defensively. 78% of MDs fear being sued, and 81% of residents say every patient is a potential lawsuit. And as a result, 83% of doctors ordered more imaging and more tests purely to stop being sued. You have to believe that the cost of defensive medicine is costing us dearly. $15 billion per annum, in fact. It works out at about $1.19 per week per American. And of course, there's a shift from worrying about the well-being of patients to being far more concerned about how do I protect myself legally, and I can't blame them. Here's an example of the cost of defensive medicine. In America, more open-heart surgeries are performed if someone just has a heart attack than in Japan, and yet outcomes after a year aren't any better in the US. It's estimated that 20 to 30% of all US medical treatment is unnecessary by comparison to what is done in other countries. And then there's the cost of specialization, which is huge in America. And here we have it. Only in the Netherlands are specialists paid more than what they are paid here. To have surgery here is also expensive. For example, my father just had a knee replacement in South Africa. It cost him $13,000. Here, that would have cost him about $25,000. And our neighbor next door, he had a heart bypass that cost $73,000. In South Africa, that same bypass would have cost $37,000. And then there are countries that are a lot cheaper than South Africa as well. Being hospitalized in America is also much more expensive than any other country. As this conversation in 2009 shows, after 4 hours in ICU, she received a bill of $16,583. 2011 statistics show that the average hospital night in America costs $8,000 compared to only $4,000, for example, in Germany. But that must be because our hospitals give superior service, right?
Fundamental question is, if I walk into an American hospital today, am I demonstrably, clearly safer than I would have been 15 years ago? The unfortunate answer is no.
And as you can see from this slide, look at how medical care has gone up since 1975, but then take a look at the cost of medical malpractice, 2,500% increase. That's huge. And there's also the problem of overprescription. Americans take more prescription drugs than any other country in the world by a long shot. And let's look at the alarming cost of prescription drugs. Fact is, our drugs are about 44% more than Japan and about 280% more than you can buy them for in Mexico. And if you're thinking that's not a problem because you buy generics, just imagine that doxycycline, a well-known antibiotic, has gone up by 5,000% per pill in 1 year.
An opinion piece in today's New England Journal of Medicine spells out the staggering price hikes. Our Dr. Holly Phillips is with us. Holly, good morning.
Good morning, Charlie.
So what's the bottom line for patients?
I see this as a very dramatic and in many ways unsettling reminder that the generic drug industry is still very much for profit. So looking at data over the last 6 months, 2/3 of generic drugs increased in price, 1/3 of generic drugs decreased, but those increases are really dramatic. If you take a drug like doxycycline, I prescribe that all the time. It's used for Lyme disease. It's an antibiotic. It increased by 5,000% the price per pill in the last year. Another drug, captopril, is used for high blood pressure. The price per pill went up by more than 2,500%.
Well, according to this report, we're being robbed. Major drug companies raped in $85 billion last year.
And it's very hard for the consumer to protect themselves. For instance, even if you do have insurance that has a drug plan, if your drug price is increased by 5,000%, you're going to see that in your copay. I have a lot of patients in my practice who they don't have a drug plan, and they say, but you know what, if I need a medication, I'll just make sure I buy generic and I'll pay out of pocket. That's not going to be very realistic going forward.
Thanks so much, Holly.
But drug companies earn profits of about 30%, and they spend 2 to 3 times more on advertisements than they do on research and development. There are major problems with the drug industry. Huge profits and a lack of integrity are only 2 of them. They use manipulative and duplicitous ads. They sell sickness even to the healthy. They overemphasize the benefits, and do they downplay those side effects? You can hear them in those speeded up advertisements as if they're nothing. But it's a profitable business, very profitable. You'd think with these huge profits there wouldn't be a need to deceive us, but greed knows no bounds. They sponsor the clinical trials and stage manage the results, as Dr. Ben Goldcare tells us in this segment.
So this took all of the trials that had ever been conducted on antidepressants that were approved over a 15-year period by the FDA. And then they went to see if these trials had been published in the peer-reviewed academic literature. And this is what they found. It was pretty much a 50-50 split. Half of these trials were positive, half of them were negative, in reality. But when they went to look for these trials in the peer-reviewed academic literature, what they found was a very different picture. Only 3 of the negative trials were published, but all but 1 of the positive trials were published. We were misled. And this is a systematic flaw in the core of medicine. Publication bias affects every field of medicine. About half of all trials, on average, go missing in action, and we know that positive findings are around twice as likely to be published as negative findings. This is a cancer at the core of evidence-based medicine.
Now, if we didn't have this cancer, maybe we wouldn't have so many medicines withdrawn from the market, having caused thousands of deaths and many, many injuries, some of them having been withdrawn after only 3 months, when apparently they did great clinical trials.
To me, this is research misconduct. If I conducted one study and I withheld half of the data points from that one study, you would rightly accuse me, essentially, of research fraud. And yet, for some reason, if somebody conducts 10 studies but only publishes the 5 that give the result that they want, We don't consider that to be research misconduct.
And they don't stop at research fraud. They infiltrate the medical schools and brainwash all the newest medical minds. They buy research journals. They know just how powerful a scientific research article can be for their bottom line and their sales. And they threaten to pull their advertisements if an editor so much as questions their research. They're a pretty powerful bunch. And money talks. They buy doctors, conventions, symposiums, drug samples, and even pay them under the table for so-called consultations. And Big Pharma knows exactly how to get the laws passed that they need to serve their purposes. They buy political control with their hiring policies, their lobbying, and their campaign contributions. They have deep pockets. And antibiotic use is epidemic. For example, over 30 million pounds of antibiotics are used every year in humans. That's about 10 teaspoons per person on average. And over 25 million pounds in animal husbandry, which goes into our food chain and our water supply. Even the CDC says that antibiotics have been overprescribed. For example, 90% of upper respiratory and sinus infections are viral or fungal, so antibiotics are actually contraindicated, yet approximately 50% of patients actually receive antibiotics. And over 90% of sore throats are viral, yet 73% of doctors' visits for sore throats result in receiving an antibiotic. It's no wonder that with such overuse, we're seeing a huge uptick in antibiotic resistance to harmful bacteria, which even the World Health Organization is now recognizing and saying that they're losing their effectiveness in every country. And so we have less effective drugs, downright dangerous side effects, and prices for these keep going up and up. And not just for medication, but for medicine in general. You can see that over the period that wages have gone up 16% and the gross domestic product 168%, medicine has gone up 818%. According to an article in the 2014 October edition of Huffington Post, medical costs are set to double over the next decade. And I'd love to think that we're protected by the Constitution and the law, but we really aren't. And as long as politics is dominated by big business and lawyers, we won't ever be protected. And the sad truth is that over 50% of our House and Congress are lawyers and big business. So, in a nutshell, here's where we sit. We have the highest bankruptcy by medicine, the highest medical costs in the world, the fastest growing medical costs in the world. But if you think that cost and duplicity are major problems, you would be wrong. It's hard to believe, but there's a vastly bigger problem than anything we've discussed so far.
Is to start focusing attention on the third leading cause of death in the United States of America. And that will come as a great surprise to most people. And the third leading cause of death in this country has to do with preventable medical errors in hospitals.
This is the 10,000-pound gorilla in the room that nobody's talking about. The third leading cause of death, as published in the Journal of the American Medical Association, is MD-directed treatments. This means you go to a medical doctor, an MD, he gives you a treatment and you die from it.
Estimates that as many as 440,000 people a year may die from preventable medical errors in hospitals. 440,000 a year, that's could be more than 1,000 a day.
It even has an official name, iatrogenic illness, but that's just those who die.
We are not only dealing with 1,000 preventable deaths a day, but 1,000 preventable deaths and 10,000 preventable serious complications a day.
According to the Journal of Patient Safety, we really have to be concerned about those that are harmed, because that's serious harm is about 10 to 20-fold more common than lethal harm. And the CDC shows us some pretty alarming stats when it comes to that, because of the 721,800 hospital infections in 2011, the CDC actually estimated that of these, about 10% or 75,000 people who get infected in hospitals will actually land up dying from an illness they contracted in hospital.
My question is this. Can you help us understand why certain healthcare entities have not yet adopted straightforward, proven techniques to reduce these infections?
And let's consider that medical errors are vastly underreported for a number of reasons: shame, fear of litigation, patients' fears of retribution, and many others. This is plain to see, as Dr. Brian Goodcare tells us in this talk.
When was the last time you heard about somebody talk about failure after failure after failure? Alone, ashamed, and unsupported. Here's the problem. If I can't come clean and talk about my mistake, how can I share it with my colleagues? How can I teach them about what I did so that they don't do the same thing? If I were to walk into a room filled with my colleagues and ask for their support right now and start to tell what I've just told you right now, I probably wouldn't get through 2 of those stories before they would start to get really uncomfortable. Somebody would crack a joke, they'd change the subject, and we would move on. And in fact, if I knew, and my colleagues knew, that one of my orthopedic colleagues took off the wrong leg in my hospital, believe me, I'd have trouble making eye contact with that person. That's the system that we have. It's a complete denial of mistakes.
And so if you take that into account, it looks like we could be losing up to 990,000 people a year. That's the equivalent of 4 jumbo jets just falling out the sky every day.
A handful of terrorists fly 2 planes into the Twin Towers. 3,500 people die and we go to war. But 15,000 people a month are killed by medical doctor treatments, and we don't bat an eyelash.
Houston, we have a problem. There is one huge disconnect going on, and if we don't recognize it, we're doomed.
Harm is preventable and not tolerable. That science, patient safety is a science, and science must guide it.
And there is some very clear science to guide us, because medical research is littered with the fact that 75 to 90% of all doctors' visits are related to stress. Stress, 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 and more stress. It's everywhere. Just think about what a fear-mongering world we live in. How many fearful messages the babble box brings into your home day in and day out. If it's not Ebola, it's the bird flu. If it's not Al-Qaeda, it's ISIS or something else. On and on it goes. We have the dis-ease of busyness, the dis-ease of technology, the dis-ease of pollution. There is so much out there that causes us stress. But here's the problem. Only 3% of counseling by a doctor ever touches on or addresses stress. They're more likely to counsel you about nutrition, obesity, or staying active. But the truth of the matter is that the average doctor with a 10 or 15-minute appointment time does not have the time to address stress as well. It's a major disconnect. Stress changes the way our body works. It shuts down cell functioning. There's a huge and growing amount of research. Stress is the real issue we need to start addressing. But it isn't making the headlines it should make. Is that scary enough for you to consider some new options? I'm here to tell you that if you're open-minded, there are other things you could be doing. Things that are free, accessible to anyone and everyone, young and old, even the very poorest. And there's more good news. It will only enhance your life, and all the side effects are only positive ones. And I can show you the way. But not everyone is ready for this radically different approach. Because everyone can do this. Are you one of the few? Are you ready to learn how to activate your own body's natural pharmacy whenever you need to? Just like those centenarians that I study who never go to doctors and avoid hospitals, you're going to learn how to take control and become your own healthcare provider. And no, it doesn't mean you'll never use a doctor. You're going to learn how stress kills you and how positive emotions can cure you and prevent you from getting ill. I'm going to give you 2 important clues right now. The biology of love is health enhancing and it heals. Amazing, but research proves this. However, the biology of fear is health eroding and kills. There's plenty of research pointing to this too. And by the end, you'll realize how as you heal yourself, you'll also be healing the world. It's pretty awesome. It's all based on science, and you can go and check it out for yourself.
I speak today on behalf of hundreds of thousands of Americans whose voices have been silenced forever by preventable adverse medical events.
People who are harmed lose their jobs. They lose their homes. They lose their health insurance. Many go bankrupt trying to pay the medical bills that they would not have had they not been harmed by the healthcare provider they sought help from. These are very real consequences of the failure to take action to eliminate medical errors. They are our sisters and brothers, parents and children, and they are disabled, and many of them are dead because of these events.
Have you heard enough yet? Check out our stress courses, our placebo healing courses, and sign up for our newsletter to receive our free ebook on living better longer.